Hey everyone, it's Lisa here with Hope for SCD. Time for another video. And this one is on developing a screening technique through blood or urine that screens for kidney disease, specifically with sickle cell patients. So this one is actually wide open. It's males and females. It's from birth all the way till there is no age cap. That's exciting. And it includes every form of sickle cell disease, and it also only has one major exclusion, which is you can't have had any complications besides your baseline ones 3 weeks before completing the test that they need. So you can't have been in a pain crisis and then come in and give blood or something like that. You also couldn't have had like a stroke or priapism or any of those things. So those are the only exclusions, which pretty much leaves it wide open, which is really exciting because a lot of the trials that I have found online have been pretty restrictive. So this one's not. It's based out of Cincinnati, Ohio, but based on the information, it says that they are trying to get information from a wide variety of different hospitals. And so that's really exciting because it sounds national. So you could always contact the person and want to give you her phone number at the end and find out if your hospital is participating. So their objective, and I'll read it to you and then we'll go a little further, is to rate progression of, I'm going to butcher this word, microalbuminuria, and to track and identify those more prone to developing kidney disease who are living with sickle cell. So basically right now, doctors and researchers don't know the natural progression of kidney damage in the sickle cell population. That's for children, teens, and adults. They just don't know what that looks like naturally. They don't have a baseline for it. And they also don't have any clue right now as to who's more prone to it. We've heard that people living with SC are more prone to eye damage, and people living with SS typically have more intense pain crises. But they don't have any idea of who is more prone to kidney damage, and are there things that lead up to it that are kind of markers? Is there a way to tell within your blood or your urine, what kind of the progression is going to look like or how fast it's going to come? And so that's really what they're studying here. They're trying to see, are there markers in your urine and in your blood that kind of indicate, one, that kidney damage has started, so some early markers, not waiting for all of your labs to instantly be elevated and then you're in this really difficult stage of kidney disease, not waiting for that to happen, but also seeing if there's any markers there, but also are there any markers that kind of show that this person or this type of sickle cell disease is more prone to earlier kidney damage or to more intense kidney damage? And also, based on what they find, are there treatments? Because right now there's no treatments for the early stages because they're not able to identify them until a person's already in the kidney disease cycle. So it's fairly simple. All they're doing is, when you come in for your annual appointment, so even if you're not a person that has a lot of complications and you just come in for your annual, that's when they just tack on this trial and collect a little bit more urine and blood work. So they're already collecting those two things at your annual trial or your annual visit or your child's annual visit. So it's not any extra labs. It's what they're already doing anyways. They just need, to take some away for the trial. And they do that 3 years in a row. So 3 years running, you'll just add a little bit more, they'll take a little bit more blood and hopefully you'll be able to give a urine sample. And then they're going to study it. So that's the trial. It's pretty short. The sponsor is the Children's Hospital Medical Center based out of Cincinnati, but it is national. They don't have a collaborator. And the contact for this one is Amy Shova. Her number is 513-636-6770. Stay tuned tomorrow when we go for an adult-only one. Thanks. Have a great day.